hate being a nurse. And that might be a strong statement, and I literally feel like I'm going to get upset, but I have been a registered nurse for 10 years. I have changed jobs several times because everybody's like, the great thing about being a nurse is if you don't like one area, you can go to another. And I've done ER, I've done NICU, I've done private duty, I've done IV hydration. I've tried all these different things, and I hate it. I hate being a nurse. After a decade of being a nurse, I hate it, and I want a new career. So if you love your job and you make a good living, please comment what you do for a living, because I can't be a nurse anymore. I hate it. I am so upset. I just hate being a nurse, and I wish I had never gone into this career because it has broken me down so many times. And like, even when I try to get a low stress nursing job, it's not low stress. I'm still dealing with a lot of the same stuff that I used to have to deal with when I was working in the hospital, and I just can't do it anymore. I cannot do it anymore. And if you're looking to go to nursing school, don't do it. Do not do it. If you want to work in the medical field and you want to help people, go into radiology, become a radiology tech, become a surgical tech. Do not become a nurse. Do not. I 10 out of 10 don't recommend.
I don't want to be a nurse anymore. I want to be anything other than a nurse here. Can I not apply for like housekeeping or be a secretary or something? I have a degree and I should be proud of that. I didn't say I wasn't proud. I just said I don't want to use it. What's got me thinking like this? Just too many responsibilities being a nurse. I can't handle the pressure of being perfect for 12 hours. I can't be perfect for 12 hours. I might be perfect for maybe an hour, but that's all I got. I could be perfectly unhappy working as a nurse.
Nurses are leaving the profession. We keep hearing about a nurse shortage like we all just vanish into thin air. We don't vanish. We leave. And a lot more of us are planning to. This week, Noah Wiley, the guy who's been playing a doctor on TV for decades between ER and the pit, he stood on the steps of the Capitol and he said, "Cancer is not partisan. A stroke is not partisan. And the healthcare worker holding everything together shouldn't have to beg for basic support." And he's right. But while we're being praised in speeches, look at what's happening to real nurses on the ground, okay? In Texas, a nurse who was the health officer at Camp Mystic just had her license suspended after 27 girls died in a flood at that camp. Terrible story. Awful, right? The board said she failed to have proper emergency plans and training in place, and that her lack of preparedness was likely to injure campers and staff and resulted in physical and psychological harm and loss of life. Now, let's just take a second and think about this. Nurses are dropped into impossible situations with no staffing, no real backup, no realistic disaster planning, and when the system fails, their first instinct is often to hang the nurses out to dry. We're praised on camera and punished off camera. We're called heroes in public and in speeches, but treated like a disposable liability in private. Meanwhile, every shift you're carrying too many patients, staying late, skipping meals, and not having bathroom breaks and absorbing everybody else's trauma. And the solution they typically offer is a pizza party and a mindfulness webinar. It's not that nurses can't hack it or they're not tough. It's that the math doesn't add up anymore. Your license, your body, your family, your mental health versus a system that will applaud you at a rally and then throw you under the bus when their lack of planning catches up with them. So no, it's not a nurse shortage. It's a we're done being abused and blamed for a broken system shortage. If you're a nurse who feels all of this and you're quietly planning your exit too, you're not crazy.
These young doctors who have gone through at least 8 years of schooling and sometimes 4 years after that, and have $500,000 in student loans, 20% of them have already left medical practice within 5 years. What does that tell you? The medical system's not just broken for us, it's broken for them too. It's because of bureaucracy, the emphasis on profits. New doctors in practices, they're given 6 minutes per patient. Well, what is the risk to them? This is not treating patients. This is not being able to provide responsible healthcare. This is running patients down a conveyor belt to chase the almighty dollar. And then they get the shit suit out of them every time. There's a million things that can go wrong in the human body. You make a tiny mistake and, well, in this country, you're gonna get sued for millions. So you look at the amount of stress that causes, and that has got to be why doctors are leaving the medical field at an astonishing rate. In fact, to see how shocking it is, just since 2008, when the average age of doctors leaving their practice was nearly 60 years old, now, just 18 years later, the average age that a doctor leaves the medical field is 48. 48 years old, and they are already burned out.
I'm saying this in the most respectful way possible, but no amount of self-care days, retail therapy is going to fix the absolute dread on your soul that is your bedside nursing job. Also said in the most respectful way possible, but sometimes it's just not going to get better. And it's actually really cool to quit a job that makes you miserable. And who cares if it hasn't been a year since you started? Who cares if you're going to lose your skills? Chances are the unit is always going to be short-staffed. The unit will always give you way too many critical patients at one time. The nurses are probably always going to be mean, and you probably weren't meant to be there in the first place. I am saying all of this because I wish somebody sat me down and said, stop choosing to be miserable. Stop allowing your job to consume your life. Stop thinking that you have to stay somewhere because of societal norms, and choose yourself. Nurses love to wear their burnout and misery like a badge of honor. Like, if you're not burnt out or miserable at your job, you're not doing it right. And that is such flawed logic, in my opinion. And let's use critical thinking here and know that if you love your job and you have a healthy work-life balance, this video is not for you. But I'm talking to the people who have physical symptoms when thinking about their job, who have weight on their chest, who cry before every shift, who have so much dread surrounding the nursing career. I'm going to slap you in the face in a nice way and say, apply for other jobs and just quit. Just go. I promise you, someone who has left their job that made them miserable and now loves their job, it is so worth it.
My name is Frances May Harden. I'm a 33-year-old ENT surgeon, and I'm leaving medicine for good. No one would ever become a doctor with the intention of leaving medicine. We even see this modeled for us where surgeons operate well into their 70s, and even then somebody has to pry the scalpel from their hands. But for me, over the past 10 years in training and in practice, the disillusionment with medicine has been too great for me to stay. All of us know what it's like to be in the wrong situation, the wrong job, the wrong relationship, and so many of us stay really a lot longer than we know we ever should have. Because it's hard, it's scary. And I had an inkling that this was not right for me when I was a junior ENT resident. But the thing is that back then, I was not brave or creative enough to leave. So I just kept my head down and I finished training and went on to become an attending. The thing about becoming a doctor is that by the time that you realize it might not be the right fit for you, you've already put several years, so much time and effort and sacrifice into the career. It's very hard to leave. I'm making this announcement for every person who's ever felt guilty for even for a moment questioning or doubting their profession. And I'm excited to announce that I've changed. I'm brave and creative enough, and so I'm leaving.
Nursing is the most toxic profession of all time. I can't even think of another profession more toxic. If you can, let me know. We're not meant to be on such high alert for such a long period of time. We're always in constant fight or flight mode. We are always activated. Even when you're chilling, you're not chilling. The amount of anxiety, the amount of stress that is put on our minds, on our emotional well-being, no human should ever have to go through. 1 minute you're coding grandma in one room, then the next second you're getting yelled at by someone who's mad because they waited 30 minutes in the ER. And then the next moment you're coding baby. And then the next minute someone's mad at you for not bringing them water. Nah, this ain't it. People are like, oh, you just can't let it bother you. What? We are put in between life and death. And you're just expected to go home like everything's okay. And then you show up to work and people say, do better. You didn't chart this on time. You didn't give this med on time. Insane. It's insanity. I don't know how we normalize such a toxic profession. People are like, oh, you can make it better one step at a time. No, there is no getting better. This machine has too much money. One of the largest sectors, one of the largest, most profitable sectors. Billions and billions of dollars. Dollars I can't even imagine. Nah, we're just pawns. We're just pawns in this game. So call off. Quit or don't. Do whatever you want. None of it matters.
I'm quitting my nursing job. I'm quitting my nursing job. Yeah, I know, crazy. I have officially 2 weeks until I put my 2 weeks in. And honestly, this is a decision that I really struggled with because this is like the best nursing job I've ever had. Without a doubt, this is the most money I've been paid for nursing. I honestly think it's one of the highest paying nursing jobs in the country. And I'm about to quit. I'm about to quit. Oh my God. I'm about to quit with absolutely nothing lined up. Just vibes. Just vibes. I couldn't be more excited, y'all. I could not be more excited. Y'all know I've been burnt out from night shift and I've gotten told no that I can't switch to days for over a year now. I've been asking multiple times for over a year and I still have not been switched to days. That's the biggest thing. I've told y'all night shift was ruining my life. I meant it. I'm willing to forego the cash. I'm willing to forego the prestige because night shift is ruining my life. That's the first thing. 2, y'all know I'm tired of the ICU. I'm tired. I'm done. I'm done. I'm done with the ICU. And working here, getting off night shift and getting out of the ICU, unfortunately, just is not an option. So yeah, I'm about to quit.
Healthcare didn't break. We turned it into customer service. At some point, hospitals stopped acting like healthcare systems and started acting more like businesses. Now your job isn't just to treat patients, it's to keep them happy. So now you're expected to keep them alive, keep them comfortable, and make sure they leave a 5-star review. Even if you're understaffed, even if they're disrespectful, even if the situation isn't safe. That's how you get a system where bad behavior isn't just tolerated, it's rewarded. Because the customer experience matters more than the staff. And then everyone acts confused when nurses and CNAs are quitting in droves. Tell me I'm wrong.